Good afternoon, everyone. Thank you for joining us. My name is Emily Weaver. I am the clinical social worker at the Washington, D.C. Georgetown University Center of Excellence. We did have someone ask us to elaborate a little bit on our credentials at the end of our names because it does vary a bit state by state. Kara and I are similarly licensed as licensed independent clinical social workers, but I'll let Kara introduce herself and the rest of her licensure.
Hey everybody, I'm Carol Loy, and I am the Center of Excellence social worker at UAB Hospital in Birmingham, Alabama. I have the privilege of working with Dr. Victor Sung and Dr. Marissa Dean. You may know those names from research, but I've been there for about 2 years. This is my third convention, and I'm excited to be here with you guys. The S on the end of mine is I'm a board-approved supervisor in Alabama.
And just a note on social work licensure state to state, it does vary. There is no shared licensure for social workers. Each of us are independently licensed in the states where we practice. In Washington, D.C., there is some overlap. I cover a lot of patients that live in Virginia and Maryland as well, but given that I don't bill and my main office location is in D.C., I only maintain a D.C. license at this time. So just that's a note. Just generally about social work, and we'll get into this a bit. I recognize I think title on the HDSA agenda talks more about or mentions long-term care planning. We're really going to talk about advanced care planning very generally, just things you need to know, things to consider, and we'll get into that. And then also we wanted it to include some actionable steps across the disease process. So we'll talk a little bit about, depending on which stage of the disease you or your family is experiencing, kind of some actionable steps to take. To get us started, we have some objectives for the day. We have various aspects of planning for the future, some, like I said, some actionable to-dos at all stages, some important considerations for long-term care and thinking down the lines about planning for care and what that may look like. And then everyone's big question is, how do we pay for this? So we're going to touch on these things, I think, fairly broadly. Kara and I, because we practice in different states, and given that this is a national convention, we removed anything state-specific. And so our kind of general advice that we'll talk about throughout is to refer to your local area on aging, local Department of Aging and Disability Services, and then also your local social workers who are going to be the most versed in whatever resources or procedures exist in your state. A general mention that the documents and things we'll be talking about throughout this presentation are helpful for everyone to have in place, not just individuals affected by HD. I know in my practice, I often encourage couples to complete their documents together and have these conversations together. And again, some of the foundational aspects of planning for the future are going to be the things related to law, medical care, and finances. So that's what we're really going to be talking about, is kind of the logistics of what to have in place to help you and your loved ones navigate these systems. And throwing in a quote that the only constant in life is change. A quick introduction to advanced care planning. Well, you'll see it referred throughout the presentation as ACP. And advanced care planning is the process of planning for future medical, financial, and personal care. This is particularly important for Huntington's disease due to the progressive cognitive and physical decline that we all know exists in the realm of HD. And our biggest thing as social workers, I know Kara and I both talk a lot about the patient's right to self-determination and being able to name what it is that you want for yourself. And so advanced care planning really ensures that your wishes are respected, even if you are no longer able to communicate those wishes for yourself. Why is advanced care planning crucial for HD patients? We know and understand that Huntington's disease affects decision-making abilities as the disease progresses. The biggest thing we'll talk about is getting documents into place while you're still fully capable and cognitively intact for making those decisions. Planning ahead helps also alleviate burden on family members and reduce stress. If you have already explained or at least identified some of what your wishes are for family, there's a lot less guesswork, and this could be we'll get into it, but even code status like a do not resuscitate or full code, things like who you want to be able to speak to your bank and things like that on your behalf. So again, having this all kind of written out, planned, and explained ahead of time does help alleviate some of that stress and burden for caregivers and family members that are left to take on some of that decision making.
Okay, so let's get into some of the documents that you're going to need. Hopefully some of y'all have already started on these things, but the things that you're going to want to have in place are a living will, a medical power of attorney, and a financial durable power of attorney. So we'll get into each of those. A living will is a legal document that states your preferences for medical treatments if you're unable to communicate them. So that looks like, do I want life-sustaining treatment? Do I want a feeding tube? Do I want to be intubated? It's kind of thinking through what type of care that you want if you're unable to communicate your wishes. And so then you would establish a medical power of attorney to then carry out those wishes for you in the event that you cannot. So I know at least in Alabama and probably in a lot of states, this is under an advance directive. You have the living will and your healthcare proxy or medical power of attorney that you designate within that same document. They're pretty easy to put into place. Usually, some states may need a notary. Alabama, you don't need a notary. You just have witnesses sign it along with your medical power of attorney. So it's pretty easy to put into place, although I know the conversation is not always as easy, and making those decisions is the hardest part of this. So financial power of attorney is someone that you designate to manage your financial affairs if you're unable to do so. So a little more about the POAs, as you may hear them called. Again, these are people that you designate to carry out your wishes. And again, it's pretty easy to fill them out. With the the financial durable power of attorney, that does require a notary and witnesses as well. And I would also advise that you have more than one power of attorney. So maybe you have your initial person that you trust to carry out these things for you. But in the event that they can't, have a backup as well, maybe a third backup. So just making sure that you're covered on all fronts. I would also say that it's so important, like we've said, to do these things in advance. But if you already have somebody that you know is going to operate in your best wishes, then please choose them to do so, and go ahead and write this down, especially before there's more cognitive issues in your disease progress. Because I know a family that ended up needing to use the financial POA to be able to help their loved one who started having difficulty managing his money and had some, he thought he had more money than he really had and was taking out several credit cards. So for his best interest and for the interest of his son as well, they wanted to protect his assets. So they were able to use a power of attorney to then call the credit card company and close one of them. They still gave him autonomy, still kept one of them open, but they were able to set a limit on it. And of course, he wasn't happy about that at that point, but he had chosen them ahead of time knowing that they would carry these things out regardless of how he felt eventually about it. So, and you can always update these things as time goes on, but if you have someone like that, then that's a gem, and you want to be able to use them for these forms. I would also say it's important to be able to update these regularly, and then if you live in multiple states or if you move to a different state, these are only good for the state that you live in, so make sure that you complete them for each state. So another thing about financial power of attorneys is Emily and I have both seen situations where the family didn't have a power of attorney, and the individual ended up getting in a car accident or something like that and was not able to carry out these decisions or be able to pay their own bills and things like that. And because he didn't have a power of attorney, they weren't able to pay his mortgage or his car loan or do much. There's a lot of, banks won't even talk to you if you don't have power of attorney. So it's important to have this in place for that reason. And again, this is for everybody, not just for people with HD. So just a little bit more about that. Just questions to consider. Have you selected somebody? Do you trust them to manage your finances? and have you discuss the financial decisions they may need to make on your behalf. So you don't always have to use an attorney just because it says attorney in it. You don't have to use an attorney to fill out these forms. I did have a family that was like, Kara, we're taking forever to fill out this power of attorney because we haven't gotten an attorney yet. And I was like, no, you don't have to if your financial situation isn't very complex, and theirs wasn't, then you don't necessarily have to use one unless your family situation is complex, or you own a lot of property, or maybe you own a business. I might consider hiring one for that if you feel like you need to, but you don't have to. You just need a notary and some witnesses.
I'll talk quickly about a living will, and it ties into, like we were just talking about, medical and financial power of attorney. And so a living will is a document that provides instructions for medical care, like I mentioned earlier, a resuscitate versus do not resuscitate, feeding tubes, blood transfusions. I've seen that a handful of times. For example, those who are Jehovah's Witnesses can't accept blood products. So that's a big one that I see listed in an advance directive, because they want it specifically identified that should they be in a situation where they're requiring a transfusion, they do not want one. So having these documents in place ensures that your wishes are going to be carried out in the event you no longer have the ability to communicate your own wishes. Something that I also always emphasize to my patients and families is that these are put into place ahead of time, but do not go into effect until you no longer have the ability to make that decision. So sometimes people are afraid that by naming, say, their son or their daughter or another relative as their power of attorney, that that person will be able to usurp any of the decisions that they're making. As long as you are of sound decision-making capacity, you can still make decisions for yourself. These are set up ahead of time, again, to go into effect when you no longer have the ability to make those decisions. I'll also mention, especially as it relates to medical power of attorney, speaking from DC, and I think most states, typically follow a next of kin guideline in terms of identifying who the next decision maker is. So should you find yourself, in the emergency room and you're unable to make these decisions, they typically defer to next of kin. That does not, so for example, I would be my mother's next of kin, but there's no differentiation between me or my sister. So it's not because I'm the oldest, the decisions go to me, it is we are both equally considered next of kin. So say my sister and I didn't agree with what we should be doing for mom, and mom didn't outline it prior, that's where you get into that kind of back and forth about what decision do we make, who is best. If mom had outlined X, Y, and Z prior, my sister and I would then have a guideline to use to help make decisions that reinforce whatever mom had decided for herself. I also mentioned this in the case where I have had, before joining the HD space, I worked a lot in stroke and brain injury. And so I would have, again, people who unexpectedly ended up in the hospital and severely incapacitated. And maybe they were legally married but separated. So next of kin would say that their spouse is the decision maker. Because they're legally married, the law says that person is then the decision maker. But if you have been separated from that spouse for 10, 15 years, you don't get along, and that's not the person you would want making decisions for you, unless you had a power of attorney in place naming someone else to do that, the decisions would be left up to your spouse as you were legally married. So it's something I like to talk about, just thinking broadly about your dynamics, who in your life you trust to make decisions on your behalf, who you want to make decisions. Again, it's a very personal decision. I know I'll speak for myself. I also have my advance directives in place, and my mom is not my power of attorney because I knew that if I were in a situation, I think she would be too emotionally invested to make a decision that aligned with what I wanted. So my best friend is my power of attorney because I know that if I outlined explicitly for her X, Y, and Z, she would make those decisions for me. And so that's what's important to consider too as you're thinking about these documents. Is this me? You? Sorry, guys. We're Kara and I, again, work in separate states. We collaborated on this remotely, and then today's our first time together putting this on. So talking about, again, advanced directives, like Kara said, you don't need a lawyer to complete these. They are fairly easy to find templates online. I know my medical network in DC, the hospital network that we work with, has their own templates for advanced directives. DC, a lot of the area on aging, your local Department of Aging and Disability Services also have good resources and good contacts local to you that can help facilitate some of these documents. Other orders you'll see, so something that we commonly work into discussion in my clinic is, it's named a couple different things in different states. I think it's most widely known as the POLST, Physician Orders for Life-Sustaining Treatment. There's a few other variations, but the orders all do the same thing. And so that is the document in terms of, that's really an internally used medical document in a facility, but it helps explain, these different variations in care and at what stage would you like this treatment. If you go to the emergency room, do you want them to perform X, Y, and Z? Do you want to do enteral nutrition, like a feeding tube? I know at my clinic we often advise against a feeding tube, but that's a conversation to have with your providers and to talk about, the implications and how that may work for you and your family. Again, talking about do not resuscitate or do not intubate. And so you hear often like a full code or do not resuscitate, which feels like a very black and white. You've got one option or the other, but there's a lot of other smaller things to consider in between. And so the POLST and similar documents help to kind of explain some of the minutia of making these decisions. And maybe you want to be you want compressions, but you don't want to be intubated or things like that. So it's important to talk with your provider about what your options are and to help. I'm a big pen and paper person. I like having a document, even if you don't have it signed, but to use it as a guideline or a conversation point to start talking about some of these things.
All right, so I forgot to pull these up before we started our presentation, so I'm not going to click on them because I don't know what's going to happen if I do, but just kind of jot these down. These are some planning guides that you guys can use online. I think planning guides are really important and helpful. I don't know if you're like me, but when you're thinking about these big decisions that do feel kind of black and white sometimes, I'm like, well, what are the pros and cons of performing CPR? What are the pros and cons of using a feeding tube? What are the pros and cons of these things? I don't know what I would want. So sometimes the planning guides can be really helpful for that, to kind of walk through that. There are videos on some of these websites that you can hear from others and kind of maybe what decisions they made, or just kind of some things to think about when making these decisions. It's also helpful in just determining your values, what you want as a person, what you want for your family, and then how to start having these conversations with your family, because it's so important to have these conversations with your family. Let's see if there's anything else. Okay. So there's the NIH Advanced Planning Guide. There's Prepare and 5 Wishes. These are electronic advanced directives that you can fill out. The 5 Wishes, I believe, you can do it electronically, and then they can send it to your medical doctors. So I think that's pretty cool. You can also pay a very small amount to get it in paper as well if you would like that. I would recommend at least having a paper copy of something, because you just never know what could happen to an electronic document. So so these Prepare and 5 Wishes is great, the Conversation Project, and then of course the HDSA has a planning guide on their website as well. Some other things to consider just in terms of end of life is, would you want to donate your brain for HD research? Or would you want to donate your organs for science? HDSA Legacy, they kind of have a partnership with the Harvard Brain Tissue Research Center. And the cool thing about this is it's free to donate, and you can still have an open casket ceremony. So if you did feel any sort of inclination to donate your brain to HD research, it is something that you do need to coordinate beforehand, and your medical power of attorney, family members, whoever needs to know that this is something that you wanted and that you already arranged, because there is a span of time that they need to come and get and collect. So you may want to donate your body to science. MedCure is just an example of an organization that you might look into to arrange for that. And then just real quickly, estate planning, of course, again, financial durable power of attorney. Please have that. Durable means, I meant to say this, the durable part means that it endures or it lasts beyond when you may become incapacitated or unable to make these decisions. So you want to have a durable power of attorney that does not end. Then free will. HDSA is actually partnered with free will. You can find it somehow. I'm assuming you can search it on their website and find this. You can also just go to the website, the main website. But this is a place where you can create your last will and testament, which is different from a living will. This is your last will and testament, so this is more like, who do you want to give your things to, and so on. So we need to have those things in place too. So that's another important legal document. You can do it for free. Again, some people will hire an attorney if they have a more complex situation or complex family situation or something like that they need to navigate. Totally fine, but I always like things that are free, so I thought I'd let y'all know about that too. Allison Bartlett with the HDSA did make a really in-depth YouTube video on estate planning in HD. So again, just more things to consider specifically with the Huntington's disease course. And so I definitely recommend looking that up if you haven't already watched that or maybe come to convention and heard this already. I learned a lot from that. This one's my personal favorite. It's a Make a GYST binder, and I don't know if y'all know what that is. It's got a spicy title. Get your SHIT together. But we could also say get your stuff together binder. That's fine. But if you look it up, that's what it's called. And you can find templates online. You can even get like a cute binder on Etsy or something. They're all over the place, and there's different creators of these. But I really like it because it helps put all your things in one place. Because I don't know if any of y'all have ever experienced the death of a loved one. You go into their home and you're trying to help arrange things and you can't find anything. And so this is a way to like bring it all together and then also make sure that you're checking off the boxes, that it's a very comprehensive checklist. It even goes so far as to like funeral planning, things for your family members to do for you after your passing. So it covers a lot of the things that we've covered today, but when I've looked at them before, I've been like, wow, this really, I didn't even think about some of this stuff. So if y'all are fans of checklists like I am, like I even will write something I did and then mark it off just for the thrill. So if you guys like doing that, you want to get your stuff together, then check out that. Also, we'd recommend working with a financial advisor to prepare for retirement, disability, investments, like all of that. Like those are great ways to prepare for your future, make sure you're covered all around, get the insurance that you need, whatever it is. So, and I feel like most people know this, but largely you don't really have to like out of pocket pay a financial advisor. They just kind of take some off the top of whatever money they make you. But look, if they make you a lot of money, then you're probably not going to miss it that much. So work with a financial advisor. Maybe y'all attended the ABLE accounts session earlier. That could be something to consider and you might consider working with a special, what you call them? Special trust financial advisor. Trust, yeah, that person. Other protections, especially considering HD and the cognitive things that happen, we know that it leaves our loved ones vulnerable to scams and identity theft. So one thing you may consider is identity protection. I put national banks, but I meant national credit bureaus. You may want to get identity protection through them or through something like LifeLock or Aura. Those are a little more costly, the LifeLock one definitely, but it's like a monthly cost and they protect that. Careful is scam protection for older people and people with memory disorders, so that might be something to look into as well. And then just to wrap up this section here, how do you get started on all this? Well, really it just starts with the conversations. We've been saying this whole time, talk with your people about this. We know it's not a super fun conversation to be like, hey, let's sit down to dinner and talk about my death. Like that's not a fun conversation to have, but it's an important one. Or just talk about like, hey, if something were to happen to me, here's what I want to happen. And what's so important about this, and what I always tell my patients is, we, like self-determination, we talk about that, we want you to have a voice. We want you to continue to have a voice, even if suddenly you can't voice what you want. So that's what this is, and it's legally binding. Or it's legally recognized, not necessarily binding, but that's why you want to make sure to not just leave it at the conversation, but write it down and get it on these forms as well. You're also going to share these forms with your healthcare providers. Make sure they have that, of course, the power of attorneys and proxies that you choose. If you have an estate lawyer or elder care lawyer, then give it to them as well. Make sure to have a copy for yourself. And then, like I said, keep it updated and everything. But really just start the conversation.
And I'll add too, just to elaborate a little bit or add some detail with the advanced care planning, and when you're putting together a living will, you can make it as detailed as you want. And so I'm always saying to my patients, what I want for you is what you want for you. Like I really want to uphold what it is that they want, and that's in life and even in death. And it's also in that in between. And again, I know we're talking about this in the context of Huntington's disease, but we are all aging. This is something that all of us need to be thinking about, whether we have a neurodegenerative disease or not. And sometimes people will even go as far, there are some good planning guides out there that even go as far as, when I'm really at the end of life, and I'm on hospice and I'm at home, and you can name what room in your house you want to be in. Spell it all out, have these conversations. I was talking with someone recently who said, at the end of my life, my sister wants to be all dolled up. She said, I want to be in my comfiest nightgown and don't have a bra on. And she said, that's what I want. And I'm going to write it down so that everyone knows, and that that my family can honor that. And so, I've talked with people, what kind of music do you want to have playing? Do you want your comfy socks on? What do you want your space to look like at the end of life? Because if you're not having these conversations, no one will know. And your family will do your best, but maybe my sister thought I wanted to be all dolled up and in my nicest things. And I said, no, I want my fuzzy slippers and my socks. And so, it's important to, down to the finest details, we want to uphold for you what it is that you want and what you want your life to look like. You are in the driver's seat, and so that's why we talk about getting it written down, at least having the conversations, silly things like that, what I want to be wearing and what room I want to be in. You don't necessarily have to have that written down, but talk with your loved ones about it so that they have some idea of what it is that you want. I know in my own home, my dad is very willing to talk with me about what he wants at the end of life. My mom stands in the kitchen and says, I don't want to hear it, I don't want to think about it, I don't want to talk about it. So I force her, slowly but surely, and worm some details out of her. But it's mostly because I say, how about, even if you don't want to talk about it, if it makes you uncomfortable or you don't want to think about your own mortality, think about what position I will be in, and, say, I want to alleviate this burden and the guesswork and the stress of making these decisions, for my kids or for my power of attorney who needs to make it. So the next 3 slides, again, we wanted this to be kind of action oriented. So, and it kind of serves as a checklist, but things to be considering at early, middle, and late stages of the disease. So in the early stages, these are things that I'm always talking about with patients that come through my clinic, to get connected with your center of excellence or your chapter social workers. Get connected with the resources that are in your area. Even if you are pre-manifest, get connected. See what they have, get familiar with who's there and how to access their services. Again, talking about advanced directives. You can update those as you go. Start basic for now. If you just say, I at least know what decision maker I want in the event of emergency. Again, we're talking about this in the context of progressive Huntington's disease, but all of us are still susceptible to a car accident or cancer or some of these other things that may sneak up on us when we're otherwise thinking about Huntington's disease. So it's important to have it earlier rather than later. So again, just a good checklist, like Kara and I, we both love a good checklist. A advanced directive, your medical power of attorney, financial power of attorney, living will. Create any of your relevant patient portal accounts. If your health network has, if your health network has a patient portal, it is great to go in there and access. You can read your medical notes. You can, collect your documents that way. You have access to just updates about your care. It's a great way to message your providers as well when you don't have another means of communicating. Explore brain and body donation like we touched on. And I'll add, with brain and body donation, most of the programs require, say if I intend to donate, they require that I have those forms completed well before my death. I have to do it myself and sign off and consent before death. And so I need to get clear with myself, is this something I want to do? Because if it matters to me, the only way to make sure that it happens is if I'm consenting to it now. We mentioned the Harvard Brain Bank, and I'll also add, say I'm at Georgetown University, it's a teaching hospital. Georgetown Medical School accepts brain and body donation. So as long as you have had a medical record number, a singular encounter with our hospital system, you're eligible to donate to our medical center. I know at Georgetown they do, Georgetown is a Jesuit university, so there's a big, they hold a mass every year to honor anyone who has donated their body and brain for research at Georgetown. So consider asking, what resources, again, in your area, your hospital networks and other teaching schools and things around you, there may be local resources that we haven't named. Again, discussing plans and wishes, and consider engaging in research. There's a lot of research that is ongoing, and it's great in those early stages to, again, at least know your options, get familiar with where you can access research and understand how to learn more information about trials. Middle stages, this is where we continue discussing plans and wishes for end of life. Start engaging help and support at home. If you are thinking that maybe a nursing facility or assisted living facility is on the horizon for you, start looking. You don't have to move in now, but at least start looking. Tour in your area. Understand what the costs associated with each of these facilities may be. Assisted living facilities, and we'll get into this a little bit in terms of payment, but it's kind of like an a la carte system. You pay a base rate, and then any help beyond that you need, you pay at higher tiers for those facilities. Create a medication calendar or list. Kara mentioned the Get Your Stuff Together binder. I also kind of adopted from the Parkinson's Association has a great, they call it the Hospital Go Kit, and it's basically just a document that says these are my providers, these are the medications I'm taking, and so I adopted that a bit and came up with a document that I distribute to patients at my center that includes that. It includes important contact information for the people at our center. I put in terrible forms like that physician orders of life-sustaining treatment, your handicap parking placard, because we're asked for that a lot. Some of those forms are easily accessible in there, and then also places to fill in, what is your crisis plan? That way you just, in one place, have some, it doesn't have to be in depth, but at least some preliminary or basic information about what it is that you want. And again, scheduling appointments with your care team, ensuring that you have an updated medical record. I talk about this most often, and I'm sure Kara does too, in terms of when you reach a point, if you're considering applying for disability, you need a substantial medical record. So even if you're in a spot where you think, I don't need to be seen yearly, go as often as your physicians may recommend. And it's because it's going to help support, especially as you start losing your ability to work or start needing accommodations at work. This is a big thing we talk about too. If we're able to document, in seeing you in clinic that you need assistance, we can help also get ahead of some of these issues. I have a lot of folks that come to us that are kind of not at a point of no return, but at a point where it's a lot more difficult for us to start implementing reasonable accommodations or providing some help to them because they've suffered so long in their job that maybe they're already on a performance improvement plan and things like that. So the more you're engaged with your local resources, the more you're able to get ahead of some of these things and set yourself up for a more solid place in the future. Late stages, again, connect with your care team. If you don't live in an area that has a center of excellence, I love a good primary care doctor and keeping a good relationship with your primary care doctor. See them every year, establish a good relationship so that, when you need forms completed, because the number of forms that are required to do any of these things, to move into an assisted living facility, to move to a nursing facility, there are so many forms that need to be completed. And it is so unfortunate when people don't have a provider to go to say, I need X, Y, and Z completed. And so, speaking from a center of excellence, I know we have people that we may see annually or biannually, but in the meantime, in between those appointments, it's important to have your primary care. Again, establishing spiritual, mental, and emotional supports for yourself and family members. That's going to look different for everyone. And then again, thinking of, we get into the nitty-gritty and the fine details of what do I want my life to look like. If you know that you're going to be moving to a nursing facility or assisted living facility, how do you want that to look? What do you want to bring with you? How do you want to decorate your space? Do you want, photos of your family and friends, memory books? Are there things that you want to create with your family that you can bring with you? Thinking about, I'm big on that it doesn't have to be a transition to a super sterile environment. You can make it as comfortable of an environment as you want it to be.
All right, so as we're thinking about that was a great segue into paying for long-term care. So I'm sure many of our patients have to think about long-term care facilities as being the eventual placement for them. So you may consider assisted living. Like she said already, that is largely private pay. So you can work with senior care placement services if there are any in your area. There are national ones too, like A Place for Mom. You don't pay anything for that. If you're private pay, they'll help you find an assisted living or a skilled nursing facility in your area that is within whatever budget that you have. So I would definitely recommend that just to take some of the searching off of you. Some people use long-term care insurance there at the bottom. Most of our HD patients are not able to get long-term care insurance. Although Emily and I are both of the opinion, if you would like to try, then shoot your shot, might as well. They are going to ask you about Huntington's though. So you may get denied, but there are a couple of places that we have heard of that have allowed people with Huntington's, at least in their family, to get long-term care insurance. So, or maybe your spouse has it, and that can take off some of the financial burden as well. Long-term care insurance is an option for assisted living as well. There's also for skilled nursing facilities, the payment there is either private pay or Medicaid. Most of our patients go the route of Medicaid because, of course, skilled nursing care requires more money. So that private pay can get quite expensive, but sometimes people do have to kind of deplete their resources with that before they can apply for Medicaid. But you do, as you're looking through and looking at facilities, then just make sure that they are a facility that can take a Medicaid bed, or that has a Medicaid bed. So that is another thing too with Medicaid, and I'm sure y'all go to other sessions that explore this further with like Allison Bartlett or something. But that's another reason to maybe plan ahead as well. If you already know that this might be a placement for you, then working with an elder law attorney to go ahead and set your finances in a way that you can apply for Medicaid eventually. They do have that 5-year look back, so you kind of want to go ahead and arrange things the way that you need to, or at least know, like have a plan for what you might need to do to be able to be eligible for Medicaid eventually. So if you do become eligible for that, then the state would pay for your skilled nursing facility placement. Some other things to just consider as well, just as you're thinking about your choices. What do you want? So when you're choosing a placement, if you go and tour some facilities, what's important to you? Is it location close to your home or your family? Is it location close to a hospital? Maybe you go on Medicare.gov and you see the ratings, and we definitely recommend ones that are 3, 4, 5 stars, not 1 or 2. So you may look on there and kind of see, okay, hey, let's go ahead and check these out, see if they fit the budget as well. Amenities, that's a big one to me, and a big one that if you do go visit, which we would highly recommend, that you see, like, is it clean? how do the residents seem? Like, what's their general attitude? Do they seem well cared for? Is the staff friendly? Do they seem attentive? Is there enough staff? So that's a big issue right now. How's the food? Will you like the food there? So, that's something you might just want to look at. Visitor policies, and then cost as well, of course.
I'll also tack on as far as amenities. I know I'm in DC, so there are some very, I'll say, ritzy assisted living facilities. Some have hair salons. Some have a bar in the evenings. Some have a lot of programming and events to go to. And so, some of these couples sometimes choose to move into an assisted living together. And so maybe the spouse without HD, wants some of these amenities while they're also catering to the needs of their loved one that does have HD. This is my important reminder slide. Kara mentioned Medicaid. I know a lot of what we've talked about is the very kind of boring, the topics people don't want to address, the topics that you kind of are dragging your feet to get to, but they're also the really, really the logistics of what navigating this disease looks like. And so as terrible as it is sometimes to confront some of these ideas, I think it's the more you know, the more you can plan for, and the better things are going to go on the other end. So these are my reminders about staying on top of your Medicare, making sure you're renewing as needed, that you are, considering your plan. Talk with a social worker in your area. I know the Medicare Advantage plans are a hot topic. I don't care for personally a lot of the Advantage care plans. I think that it can really restrict your care network and sometimes limit care you may need. But in other ways, some of these Advantage care programs do have other benefits that some people need, like a transportation benefit or a dental insurance and things like that. So it's important to do some research, but also talk with, a social worker in your area who's going to be knowledgeable about how your insurance may dictate care in your area. Renewing Medicaid. I know there's a lot of changes upcoming to Medicaid, and so just, again, we're biased as social workers, but get connected with a social worker who's going to understand what's happening in your state, what you're going to have access to, and how things may be changing. Again, prescription assistance programs, we talk about Ingrezza or Neurocrine and Teva Pharmaceuticals both have patient assistance programs to help reduce and alleviate cost, but those are often require an annual renewal. And so I'm in a situation right now, we have a patient who her program expired, and now we sent her some samples of medication to tide her over until we got this, delay figured out. But it did cause a delay in getting her prescription out to her. So it's important to, if you know that it was this June that you renewed, set a reminder for May to give you a heads up to say, let me make sure I ask my doctor about that and make sure we don't experience any delays. And again, consult a social worker before you're enrolling in any, like I said, enrolling in any additional programs related to your insurance, because it may change coverage. I know we've had, unfortunately, some folks that maybe, I know it's a regional one, but Kaiser Permanente is big in the Mid-Atlantic or in California. It's one of the more restrictive networks, and so we've had patients that unknowingly opted into a Kaiser Medicare or Medicaid product, which meant they were no longer able to see our specialists. We still consult with them, but because they dictate the network, it's out of network and they can't receive care with us. So it's important to ask those questions before you make any major changes to your health insurance. Planning for end of life, I talked about this earlier, but consider questions about how do I feel about palliative care or hospice care? Do I want to live at home as long as possible, or does it make sense for me to transition to a nursing facility or an assisted living facility? I talk a lot. Sometimes families will come and say, what do I do? What do most people do? And my answer is that there's really no right answer. It's about what works for you and your family, your own wishes, your financial situation. It varies so much. The resources available in your area, again, are going to vary so greatly. And so it's really, again, talk with a social worker, talk with your primary care, talk with someone who's knowledgeable about the resources in your area that can help you understand how this plan may shape up for you. Pre-planning funeral arrangements. People sometimes, again, I'm big on talking about even down to the details. I'll also share that I had a cousin that passed away. She was very glamorous, very into fashion. Her urn was like pink quartz. I'd never seen anything like it. And at her funeral, around her, in between all the flowers and her urn were also some of her favorite dresses and heels and shoes and things like that. And it felt like such a special way to honor, we all knew her for her style and personality. And so it was such a beautiful way to celebrate her life and honor that even at a dark time at like her funeral. And so talk about these things. And, I've said to some of my friends, they're like, Emily, enough. But I'm thinking, I saw a pink quartz. I'm like, how about emerald green? That sounds like it might be nice for me. If you guys can find one, put me in it. And so, again, just talk about, what your wishes are, and talk about, and sometimes you might not be clear on what you do want, but you might know for sure what you don't want. And sometimes that alone is enough to help your family understand.
Yeah, and you can also talk with the funeral home and go ahead and if you already know which funeral home, then you can go ahead and plan it with them too. I know my mom has already done that, so she's like paying it off right now. So that's something that you can do. She's already told them what she wants. I did want to circle back to the Medicare thing. Most states, in my state and in every county, there are area agencies on aging, and I don't know exactly what it's called in all the different states, but I know through our area agency on aging, there is a program that will talk to people about the different Medicare plans. So they may be able to talk with you for free, and they are not contracted through any insurance agency, so they're not trying to sell you on anything. And that's really what you want, because, different, especially Advantage Plan people are going to come to you and be like, well, you pay this much and you get this, and then you really might be selling yourself short. So I like referring people to that program. Ours is called SHIP, State Health Insurance Program, but you might look into that resource if you feel like you need some extra help choosing a plan. So, all right, engaging with your local center of excellence. So part 2. Oh, we only got 10 minutes. Oh, goodness. Okay, we're going to fly through. I feel like y'all are probably already connected to your COE, but if you're not, then these are some reasons to do it. They generally include psychiatry, neurology, genetic counseling, social work. All these people, this is a whole team effort to help you understand your disease course, to help you think about healthcare decisions, financial considerations, and of course, as we've said a million times, we basically just want you to call us for everything. So talk with your social worker, call your friendly neighborhood social worker, and we'd love to chat with you. So, and they can help you with getting documents in place and all of that. So I'll fly through that. But just make sure to see them regularly. That's so important. And they can kind of give you a gauge on what to expect, where are we at right now, what stage are you in, what do we need to be thinking about at this time.
And again, wrapping up, a lot of this we've covered. This is kind of just really summarizing what we've talked about for the last 50 minutes. But next steps in advanced care planning, talk with your family, like we've said, complete your legal documents. These next 2 slides, or this one and the following, are really set up, again, in that kind of checklist format. Talk with your family, complete your documents, review and update your plan regularly, work with your care team to make sure you're, understanding what your evolving medical needs are, what your evolving personal needs are. Getting into, again, reflection and an action plan, your living will, your medical power of attorney, financial power of attorney, speaking with financial advisors, getting your stuff together. And this last slide, this picture is my gentle threat to get your documents done. It's an any last wishes on a dandelion. So that's my gentle threat for everyone to do their documents so that it's all done. Right. Instead of brass knuckles, it's dandelions. Again, advanced care planning matters to provide peace of mind for you and your family, ensuring that your wishes are respected. And that's really the biggest thing for us. And it's, again, especially critical in Huntington's disease because of the progressive nature of the disease. So again, our next steps are just reflect on your decisions, talk with your loved ones, and then reach out to your local supports if you need any help or guidance as you navigate this. And we'll open for questions for the last 8 minutes.
My name is Dave Vellner, and I'm an attorney in South Carolina. I just caution that it is still a good idea to check with somebody there, because these documents, if you sign them and you don't get them done in the way you want, it's too late later to do anything. Remember, she talked about the durable power of attorney, because the original ones, as soon as you became unable to answer and do your own, they stopped that. That's just what you want. So that's why they said they had to be durable. And in each state, there may be a requirement to file it in the courthouse in order for the durable aspect. It can be done later, but check with your local state to make sure, because you really don't want to think you've got a document and then it not be durable. So,
Thank you.
And
keep in mind that once the person dies, all powers of attorney end. That's it. It becomes the time for your will or someone known as your agent or whatever. And even your bank accounts, if they're only in your name, on death, the bank will not let you or your family in. I've got a power. You had a power of attorney. So there needs to be some quick thing. Remember, Social Security is going to want its last check back. Don't live the entire month.
Yes.
A couple scary things, but and you can have them online, and your state may have actually official state ones that says this is it, and you're better off to follow those for your living wills, because then everybody and the judge is used to those forms. So yes, I'm saying you should be able to go maybe online and whatever, but don't just pull off anything, because you don't want to be in a situation.
Yes.
You need it.
the biggest takeaway, consult with your local resources.
Yeah.
Yes.
you.
Question up here.
So I have a statement, actually. This is really, really important information. And I think if you go back to one more slide, the part where she says review regularly. So I'm a medical doctor, and I cover the end phase of Huntington's patients. And it's so important to know what you wanted, but to know what you might want now is just as important as what you would want 10 years ago. And that person that you may have put to be your voice is no longer around or no longer to be found. And now I'm standing trying to figure out how do I incorporate this into what you want now. Sadly enough, even as a doctor, my mother was a do-it-yourself type of person, so she went online and did it herself. And I'm in the situation where her doing it herself was the wrong way. And I'm now caught up in the legal system trying to undo what she did herself. So it does leave a significant strain on the families that is having to deal with it. So I'm 100% in agreement in making sure that it's done appropriate and to update it regularly.
Yeah.
It is healthy to talk to your doctor to say, hey, what would I want now? Do I still want the same thing that I would want then? Just to review it, just to understand the process of what next steps to do. So every time you see your doctor, just talk about it.
Thank you.
We have like 5 minutes, so I'm going to go back. Yes. Is that mushrooms on your top? Okay, yes.
Do you want this?
If you want your question captured in the recording, then you'll need the microphone. Otherwise, I can repeat it up here.
Thank you guys. This is such an important conversation. Coming from another social worker, I just wanted to stress, like, this is such an important thing. It does not have to be a scary thing. I've had patients have a girls' night. Like, this is not, it does not have to be another
I had an
isolating
advanced
thing.
planning party with my friends. We
It
said we're
does-
going to order pizza. We're going to do our advanced directives.
It does not have to be another isolating thing. It is not just about your condition. Like, everyone should have one. Do it with your friends, do it with your families, even if they don't have HD, even if they're not directly impacted other than knowing you. Like, they need one too, and it does not have to be scary. Like, it can be as fun, as personable, as human as you want to make it.
Thank you.
And up here with a question.
Two things. Your power of attorney, you said you have to wait until you no longer can do that, so can you address what those criteria are, and he might be able to address to you what the criteria are before they use your power of attorney.
Right.
The other thing is, when you have a power of attorney, you have all those documents, you do all the legal things, you still need to be proactive, because my mother, nothing to do with HD, was in a nursing home, and they weren't reading the documents that said not to do things.
Yes.
And
And
sitting there, and they're saying, well, we have to do that.
Yes,
No, I
got to be
have
the advocate
documents
too.
that
Yes.
That's right.
legal stuff that you need to be looking at.
yes. So the first question was, we establish power of attorney while you still have cognitive decision-making capacity. At what point does your power of attorney come into play? And so that it's typically usually a 2-physician certification, sometimes just a singular physician certification of a loss of decision-making ability. Again, it's something that can be evolved on a regular, and HD is tough too because cognition waxes and wanes. And so it's important to have these ongoing conversations with your medical provider. And I also always say to my patients, because we know with Huntington's disease, you can struggle with insight, you can struggle with understanding the extent of your deficits, and it can make things difficult as you get further into the disease process and you're not recognizing how impaired you are. And so what I say to my patients is, while you still have the ability to engage in these conversations, identify someone in your life, maybe it's your spouse or a good friend, someone that you trust to say, I know that no matter what, I'm going to trust and believe you when you tell me I'm at the point where I'm not making good decisions anymore, or I'm at the point where I'm really struggling. Identify someone that you may not remember, but try, identify someone that you have said, I know that when this person comes to me, it's time for me to start engaging in looking for help other places. And so it's really it's usually a physician certification of the inability to make appropriate medical decisions. You might be able to make some decisions. It doesn't mean you can't make any decisions, but it's when you stop making decisions in your best interests, when you start making those impulsive decisions, reckless decisions that may endanger you. That's when you really want to have these protections in place. Sorry, I think she's bringing the microphone to you.
I'm coming. I have a question about, okay, so you have the cognitive ability to make a decision, but no longer physically able to sign a document. How do you get around that?
It's going to depend place to place. I have seen, again, working in brain injury, I've seen people who have cognitive capacity, but have maybe from a spinal cord injury or something, lost the ability to write. Depending on where you are, you can sometimes, they'll accept like a verbal consent signature. But again, you usually have to have supporting documentation saying that you do have the ability to make these decisions. That's a letter that we write all the time from my office, is we often help provide supporting documentation to say, I recently evaluated this person. As of the appointment on this day, she is of sound mind and body to make this decision. And I just had a patient ask for that ahead of meeting with an attorney to complete her power of attorney documents, because her attorney advised, and also we advise, it's important to sometimes have a physician that has identified you are able to make these decisions at this point. Yes. Do we have any other questions?
That was,
You still have a question in the back?
oh, well.
She had a question earlier on.
Who had the question?
No? Okay. Okay.
Okay. Did you have a follow-up question?
It was more about the brain bank. I'm thinking, would they accept my husband now? He can, he said yes, but he cannot
physically sign. And yeah, I would speak with whatever organization it is to understand what their process is like. There are going to, typically like a verbal consent is usually like signed and dated by someone else, or sometimes they can name like a proxy to sign on his behalf. And so sometimes that's the way to do it. But I would contact, if it is the Harvard Brain Bank, reach out to them to understand what their process is. Or if it's another local agency, just reach out to them and ask what their process is, what forms are required, and explain. I promise that is not going to be the first time they've been asked that question. And again, I know we talk in the space of Huntington's disease, but I've worked in stroke, I've worked in brain injury. There there are so many different ways someone can become physically or mentally impaired and navigate these systems. And I
Okay.
think that's it.
Thank
We're at
everybody
time.
for being here, and thank you, Emily and Kara. If you have any other questions privately, if you wanted to touch base with them, otherwise, have a great rest of your day.